I think I'll return briefly now, firstly to Ariel and then to Dina, if you've got any immediate responses before opening out to the group.
Well, I want to answer your question. Well, not answer, but try to put forward some ideas on where is the politics in all of this. And I guess the quick answer is it's all over the place, even though I don't think it was made explicit. And those were, to some extent, the terms of reference for the team, not to. Yeah. But I would say emphasize two issues that I think are extremely important. One is one area in which politics comes in is in terms of its influence on provider behavior. Mm-hmm. Here that is taken almost in this report as given and as an exogenous aspect. But provider behavior is deeply embedded in politics. It's whether, and there's a number of interesting studies on this in India, the links between teachers and parties and the whole election process, okay? Or whether it's in the context of, say, the decentralized provision, the effect that different party affiliations between local governments and central governments interact in terms of the incentives for or the ability of national policy to influence what happens at the local level on the point of provision. So that's one aspect. It's looking at how the behavior of providers is embedded in politics, or how politics influences the behavior of providers. The second aspect is on the demand side, and the book here takes very much of sort of an individual approach. It looks at the citizen as a user of services. And I think where politics comes in is both in terms of the overall setting, the friendliness of the overall political setting for individual citizen complaint and action, but perhaps more importantly, the nature of collective action. And again, because of how the report was structured, that does not come up. That was not the subject of the report, but that's the other angle in which politics becomes extremely important. I think the report correctly identifies that that's sort of an important contextual variable. The links between the nature of the distribution of political power and the ability, particularly among poor communities, to have act as a collective, I think is the other key aspect. Yeah. So,
yeah. I mean, linking, I think Anna's very sharp point also that when you're talking about the generation of laws, the political movement and the way that leads into the generation of a legal framework is going to affect very profoundly whether it sits on the shelf or whether it becomes something active. Dina, do you want to respond quickly before we go to the floor, or are you content to wait until after the first round?
Well, yeah. I mean, just maybe 2 points. So, I mean, first, thanks so much for these comments and for taking the time to look at the report, and I really appreciate, the comments that were made. I think, Anu, your point on how to define these interventions is really important, and there is, that's one of the things that we found, and it was very difficult in a sense to even come up with the simple typology because there's so much heterogeneity, and I think especially for the information campaigns, it poses a challenge, as you were alluding to, for the evaluation. And one of the things we did, which the editor of this book, I think we drove her crazy, because we insisted on keeping this long table, which is Appendix 3, where we actually took out, how long are these interventions? How many people were involved? And, you go from a couple of hours to a couple of months, and, you can't expect to be able to compare these types of things. And so, again, just trying to get a handle on what does it mean mean to talk about scorecards or report cards, or what would you expect the theory of change to have an impact? And then Marta, you know, Ariel picked up on it as well. I like your point on the demand and supply, and then, you know, need to sort of think about them in an integrated way. And I felt like that was one of the first things that, you know, I learned in getting into this, is it's really just not about the demand side in an exclusive way. And so, you know, thinking about how these interventions can be systemic and can involve the incentives and sort of the accountability in a much more sort of a systemic way can be quite important. And I think, you know, perhaps some of the advances on the grievance redress, particularly in transfer programs, make the most sort of obvious advance in that area, because there's feedback loops in many of these programs, and adjustments that are happening even in real time with the introduction of technology. So I think that's a very important point.
Thank you very much. Now let's go for a round of comments. If you could introduce yourself and try and keep it reasonably brief, 2 to 3 minutes, so that we can get on. And we've got a microphone. Yeah. There's a mic on its way.
Right behind you.
Yeah, there's a mic making its way towards you.
Thank you. I'm Ian Buist, formerly DFID, now Plan UK and Interact Worldwide. I want to ask a question about the different types of issue which come up when you have a grievance. Take the question of a failing school. Now, I can easily see that some questions, or like you might call them the quantity questions, absentee teachers, can be taken on board pretty easily and voiced by the community, or in some ways to get some sort of redress. Issues of quality, i.e. that teacher needs retraining or ought to have access to some means of approval, seem to me much less easy for a community to grasp. And I just wonder how far you're expecting the information about rights and what to go down to tell everybody what is best, or what is best in their community. That seems to me an important distinction. One more, which is also vital for, certainly for my organisation, is the question of rights, which was put up on the board, particularly the rights of the children. We have endless complaints of school violence. And one can easily see that that's not the only issue in which there might be a division of opinion between those of the student age, or those just after, and the community in general. Now, how do you get those brought to light under any of the systems which you've been describing so far? I do think those three might need to be taken separately, and I certainly would like to see a lot more work done on them. Thank you.
Thank you very much indeed, Ian. Behind you, the next question, I think, and then.
Hi, it's Ken Caldwell. I come from an NGO program management background, and I now advise NGOs on effectiveness and accountability issues. Thanks very much for the presentation. I know you were summarising a long piece of work in a short period of time, but it did seem to me there was a big leap in the middle of your presentation from access to information to formal grievance procedures. And in our experience, then, the vast majority of effective getting of entitlements and rights lies at the community level without access to the formal grievance procedures. And there's a huge bit of work in terms of getting people's entitlements, which lies between access to information and formal grievance, which you may want to comment more about as to whether that was in the report but just wasn't covered in the presentation. With that in mind, it does seem to me, from the experience of working with a number of international NGOs on this issue, that the vast majority of the work on this has been about methodologies, mechanisms, tools, technology. And there are three fundamental gaps to seeing the widespread adopting of this, which comes from the practical experience of NGOs on the ground. The first relates to the point that Andrew was already making, which is about what are the incentives to the providers, particularly to the frontline staff and managers in the providers, to be responsive to the feedback they get from the community at local level. And how do we build that into their management systems? How do we build that into their contracting? The second is around issues of sustainability. There's a lot of experience in the NGO world about how to make these things successful as long as there's an independent agent trusted by the community. But there's very little experience of what makes it sustainable if there's no independent agent there, or in areas where an independent agent isn't available. And any comments on that would be more than welcome. And third, and perhaps most glaring gap, is the absence of information on cost. There's almost nothing out there that I'm aware of that analyses the costs of these sort of interventions and how they can be done in a way that is sustainable and replicable with local resources.
Mm-hmm.
Thank you.
Excellent, thank you very much. One more question and then we'll go back to the panel.
And
I think it's on.
okay. Anna Hazanova, I'm a director with the Afghanistan Public Policy Research Organization, and one of the things which we're dealing with is, again, aid effectiveness. And it's very interesting in this presentation, as I was listening, it seems that we're talking about this fundamental shift in the power dynamics from being recipients of services and having a responsibility to deliver services. And I guess when we're working in our evaluations, we always see this interesting assumption, almost unspoken assumption, that the providers want to do good, that they're ethical providers, that they're there because their services are needed. And rarely we're talking about the fact that these are people who feed their families. These are people who need to pay for something, who want to make the most money they can in the best possible way, even if it means that this is a pretty unethical intervention. And this is one of the things which I wonder if you actually came across in your work in trying to identify those shifts in power dynamics and understanding the, going back to the previous questions, incentives to provide better services.
Great, thank you very much. We've also had one question come in from the online audience from Sarah Haig, Head of Social Policy, UNICEF Burkina Faso. And UNICEF is working with the government of Burkina Faso to launch the first PETS, that's Public Expenditure Tracking Survey in primary education. What advice would you have on designing a strategy for using a PETS results for leveraging social accountability and increasing resources to schools? So there's a fairly direct question there.
Excellent.
And a big laugh.
We can do an advertisement for another publication that we have.
I thought you might like that. But anyway, those are great questions and there are a lot of meat in that. So I want to go back to the panel at this point. This time, do you want to start
Sure.
with any of those
just
responses?
on that question, Ariel has his hand. I know, Sarah, you can't, well, maybe you can see it on
I think
video.
if you wave it,
If
she
we wave
probably
it,
will
we
see
can
it,
send
yeah.
you a link also. So Maggie Kojal, who's one of the co-authors here, and Courtney Tolmie, who was a peer reviewer, did a review of public expenditure tracking surveys, sort of a how-to manual, and the audience for this work was, well, it can be quite broad, but we were, this work emerged out of efforts to train CSOs and NGOs in how to use public expenditure tracking surveys, and also absenteeism surveys. We have another note on that, to use these tools for accountability. And so Ariel's now showing that one. But anyway, hopefully that's a useful resource. And you know, I think the use of these tools by NGOs and CSOs is a really interesting development, and you know, sort of building capacity among civil society to do sort of evidence-based advocacy, I think is really interesting. And Courtney is with the Transparency and Accountability Program, which is affiliated with Brookings, I guess. So. I'm blanking, but I think it's really important work, and they're continuing that. So thank you for a great first round of questions. I think, Ian, your comment on, you know, how much can we actually expect people to know and what and process. I think that's something that you know, came through, and I think there's people who are questioning, you know, how much can, you know, especially when you're talking, you know, about people with perhaps, as I said, who are sort of trying poor people who have, you know, lots of different priorities or have literacy gaps in sectors where there are huge information asymmetries. You know, I think there's a risk that too much stock is put in on social accountability programs, and, you know, sort of too much responsibility perhaps for improving service delivery is thought about being delegated. So I think it's a balance. I mean, you know, what we were looking at, which I think gets to your second question, is a set of information interventions that are really about sort of giving people access to information about their rights. And I think there are some interesting examples. One of them that we cite in the book is work that the World Bank was involved in Peru, this Recurso program, which took off and became, you can look up videos online, became sort of media, sort of very prevalent within the media, where there was a campaign that told parents that, you know, their kids should be able to read 60 words a minute. And, you know, it was a really sort of powerful sort of message. And, you know, the president was on TV sort of saying, do your kids learn 60 words a minute? And it became quite effective. And then he followed on also in informing parents about the standards they should expect on nutrition and health status. So I think there are some examples that emerge.
I'll ask about the violence in schools, because it might be different standards within the elders of the community and the pupils in the schools. But this is something which comes up in every single country we're now working in.
So the
complaint amongst the pupils,
right,
for children's rights, is that their rights are being trampled on because of the universal prevalence of violence within the schools by the authorities, not by other pupils usually.
Older people may have a tolerance for physical punishment in school that children don't.
Sure. Yeah, no, I think that it's certainly an important issue, and I think it gets to the rights dimension of accountability, and, you know, what are, you know, basic human rights, and how can they sort of be enforced in different cultural contexts. It's not something that we looked at or came up explicitly in the body of examples that we had, but certainly a critical issue. So Ken's comments on the sort of leap in the story between access to information and grievance redress, and I think that's a completely valid point. We were sort of looking at, you know, the types of instruments, the methods, tools that you talk about, that you mentioned, that you see in donor projects, and that also emerge in the evaluation. But I think, you know, the sort of extent to which complaints are addressed at the local level, you know, can't be underestimated. We just don't have much. It would be a great area for you know, qualitative work. You know, some of the analysis that I saw on some cash transfer program was that, you know, the large majority of complaints are addressed and resolved locally, right? So, I mean, probably in most of our own experience, you find an error, you have a complaint, you can sort of get it addressed sort of offline, so that, you know, what's being captured here are sort of the more formal, the more serious complaints, but sort of looking at how those processes work, what are the incentives for providers, as you mentioned, to deal with that, is important. And then you also mentioned sustainability and cost effectiveness, which, you know, we conclude are two important areas for further work. And then, Anna, I wasn't sure I completely got the question. I mean, so you were talking about provider incentives and how these. So from the perspective of the provider themselves, what kind of incentives they have to respond to social accountability?
Part of it, but also I guess what for me is interesting is that this major shift in the dynamics between saying, oh, I am a person, I am a poor person, I am so blessed to get this service provider coming in, and to shift into saying, I actually a human being with a certain right and a certain entitlement for these things, and you as a service provider need to respond to me. And at times I think unfounded assumption, thinking that these service providers come in with the hope to do good, instead of thinking, well, this is the best way for us to make money because this is the way we're working. So I wonder if you had a chance to look at that dimension, or whether it's something which came out as a part of the work.
Well, I mean, I think you certainly was the main sort of theme, but I think you're talking about sort of motivation and sort of behavior change, and maybe sort of a more organic level. But I think at its core, and what we started out. I mean, the title of this work, probably when you first saw the concept paper, was agency, right? So we were really talking about, what does it mean to have agency of recipients of or clients of social services? What are the implications? What are the mechanisms? And that's how we sort of got onto this sort of the typology that I presented, of the sort of ways in which agency can be motivated through access to information and opportunities to use it. So, I think that was the sort of starting point. I think, one of the where we ended up in looking at the evaluation is that, the sort of behavioral aspect is extremely complex, and some of the experiments, do look at, behavior change, but, it's something that challenges our assumptions about how people respond to incentives, and certainly is, an important way of thinking about these interventions from both sides.
Thank you. Anu, do you have anything to pick up from those questions?
I'm going to pick up two things from the questions that were posed, and they're sort of related. I think this issue of incentives to providers that came up in a couple of the questions is really critical. I think the assumption is that somehow, if pushed to with these demands, faced with these demands, they'll somehow have to respond. And that's not the case at all. And in fact, what we've seen in some field work in India is that these frontline providers actually have no idea of where these demands are coming from. They don't come with this conceptual map of social accountability and, these demands are coming in. This is particularly in the case of social audits, where they've been forced to engage in these community discussions. They don't understand, this is not in their professional repertoire of what they're supposed to do. And it's really interesting. I think it would be a really interesting research project to actually see how they respond. I mean, how do they change their mental map as to what their work is about? And it's something that's not been explored so far, but really needs some rethinking, because that's key. I mean, without providers responding, social accountability doesn't have any substance to it. Unless you have some response, there's nothing, no impact can be gained really, apart from perhaps empowerment of communities who are able now to demand. But related to that, I think the important thing about your report is that it really points to the importance of grievance redressal. Because in the early work on social accountability, it hasn't actually looked at grievance redressal to a large extent. And in fact, even in things like social audits or citizen report cards, the assumption was that naming and shaming would get a response, and without any actual teeth to an avenue or mechanism through which you could actually complain and get, in some sense legally get a response made, or some sanction put on the providers who weren't responding. And I think that's a really important part of the work that you've done. So I'll stop there.
Thank you very much indeed, Anu. Marta, do you?
I just thought I'll contribute to this discussion on incentives for providers, which I agree are pretty crucial, with a very personal example. I'm Italian. I was born and raised in Italy, and I lived in this country for the last 15 years. If something happened to me, if I wasn't happy with the service in a hospital in Italy, I would never dream of filing a complaint, even though I'm sure the mechanism will be there. Whereas I've learned the way to do it here, and I probably would put my letter through the box in an English hospital. Now, the reason, what makes a difference is there, because I wouldn't have any reasonable expectations that my complaint will make it, will actually contribute to any change in Italy. Whereas here, I think that the incentives in place for the provider not so much the direct impact of my complaint, but the existing incentives in the systems are such that my complaint will probably tied into a logic of performance that gets determined in a way that might get a response, and I'll probably get a nice letter back, but also I might contribute to change something. Now, I think this is, the design might be very similar. The difference is in the context, but crucially the difference is what is it that contributes to change, whether the incentives are in place that make that change possible, of which the demand can play into if some conditions apply or not. So the expectations that, the reasonable expectation that something can make a difference is what I think motivate, and it's probably the answer to your graphs about why in certain cases there are more grievances than others. And that's what I meant earlier about the fact that if we stay within the problem around whether demand works or not, we might fail to move the camera towards what is it that determines change, to which the demand side component may reasonably make a difference or not.
Yeah, an interesting element, I think, in this work is how important is the clarity of specification of rights and entitlements in policy frameworks. Because I would say that's one thing that can make it more likely things will be sorted out at the local level without having to go up the chain. But you also obviously need the fear on the part of providers that if someone does go up the chain, something will happen. And that's I think, part of the incentive structure. Ariel, do you have any thoughts from that? Okay, we're actually pretty close to up against the time, and we'll be losing our online audience now. Does anyone else have any kind of urgent questions? You can also come and, I think, chat to us afterwards if you want. Does anyone else want to raise anything in plenary? Burning question to raise? Oh, yeah, there's someone at the back there, yeah.
Hi, I'm Tonya Schmidt. I'm a freelance consultant and just back from a year in Kenya working with the Kenyan government on monitoring evaluation. My question is whether there is any intention to do work that focuses more specifically on the low-income countries or countries that are known to have high levels of corruption. Because my observation is that this report is very interesting, but it attempts to summarize a huge range of countries, of different types of intervention. And my feeling is that actually the circumstances, the power dynamics, the politics are absolutely essential to agency. I don't think you can separate the two. And I think they are totally different in a country like Kenya, for example, as opposed to some of the other countries you quote, so Britain. It's entirely different. And I think that's what the lady there was touching on as well. People are, like in Italy, it's not only that you don't expect that things will change, it's that you're actually putting yourself and your family at risk potentially by saying, complaining in any way. So any plans to look in more depth? Because I suppose the other observation would be that I think one of the reasons why there may be no evidence is because it's not happening. And it's not happening because it's not practical, because people don't even keep patient records, let alone do accountability sort of surveys and so forth.
Okay, thanks. Yeah, very good question. For the bank, I'm going to actually let Ariel respond on that because it's more under his. But I'm also going to ask Marta to say some words about some planned work at ODI if you want as well.
So a couple of reactions. I think actually where I see the demand coming from is exactly from the weakest countries with the weakest institutions. As you know, we work with all the way, countries that are, have barely functioning states, all the way to pretty sophisticated middle-income countries that are members of the OECD. And we don't get as much demand on this kind of interventions from the latter, right? So there is, I think, unlike other areas, there is sort of a built-in bias towards doing research in low-income settings and in settings with weak institutions in this area. and so I do think that over time we'll see that evidence accumulating if we're smart and committed to actually taking seriously the evaluation agenda. Having said that, I think it would be a mistake to not recognize their heterogeneity within countries. And so if you take a country like, say, Brazil, that overall is sort of a pretty advanced middle-income country, you have over 5,000 municipalities that range from the municipality of Sao Paulo to some municipalities that are not only very weak, but where a lot of the symptoms that you described would still be present. So in that sense, I would not throw the baby away with the bathwater and say that it's all about research in low-income countries. I think there's quite a bit to be learned from research in middle-income countries as well.
Before coming to ODI, I didn't mean that in Italy I wouldn't file the complaint because I'd be scared of what could happen to my family, nor that the level of health services in Italy necessarily worse than the UK, quite possibly the contrary. And I do think they keep file of what's going on. It was actually a very different point. It was that the existing incentives for providers are such that I don't think that my demand action will make a difference in Italy, whereas I would reasonably imagine that it might help in this country. So, and in fact, if you think about it, Italy and England are probably, Italy and the UK are more similar in a way than UK and Kenya. But my point was precisely that the incentive structure is very different, and whether one decides to go through a demand route or not depends on what you reasonably expect to happen as a result. At ODI, we're going to do more and more work on these issues of sort of the incentives for service provision. We're looking both at demand and supply side, but we're going to try to make an effort based on our last couple of years of research, applying governance and political economy analysis at the sectoral level to get a better grasp of what is it that determines incentives of providers and that can actually result into better quality of services. And we have planned to do work around education, health and water, and we are talking to a number of possible partners and collaborators on how to take that forward. So watch the space, there will be more coming out from ODI.
Right, and amazingly, we're finishing roughly on time. So thank you very much, everyone. Sorry?
Sorry, Benedict is waving your evaluation form.
Oh, right, okay.
Thanks.
Can you please, thanks for reminding us.